Health Spotlight, presented by Community Health Network.
Well, traditionally, strokes were considered a condition primarily affecting older adults. But in recent years, doctors have noticed a disturbing trend in the rise of stroke cases among younger adults, a demographic that was once considered low risk. News 8's Brittany Noble has more details in today's Health Spotlight.
There are plenty of health problems that young adults in their 20s, 30s, and 40s have to watch out for. But until recently, a stroke wasn't one of them. However, new data reveals an increase in the number of young adults facing an unexpected battle with strokes. Experts point to poor lifestyle choices as the main risk factor. Smoking, unhealthy diets, lack of exercise, and increased stress have played a role because they lead to problems like high cholesterol, high blood pressure, and obesity. But one risk factor most people don't consider has to do with chiropractic adjustments. Doctors say forceful and rapid neck rotations during these procedures can potentially cause damage to the vertebrae artery supplying blood to the brainstem.
We see 5, if it's a bad year, up to 8 or 10 per year, just per hospital. And some of them can be quite devastating because the brainstem and the cerebellum are in a enclosed compartment that only has so much room.
Stroke symptoms in young adults are similar to those seen in older adults. Weakness or numbness in the face, arm, or leg, sudden change in speech, difficulty walking or keeping your balance, and sudden severe headaches and change in vision. Any of these symptoms require immediate medical attention, but doctors say younger adults tend to wait longer than older adults to go to the ER. I'm Brittany Noble reporting for Wish TV, wishtv.com, and like us on Facebook.
Well, doctors say younger adults face an increased risk of complications from brain swelling following a stroke due to the relatively large size of their brains within the skull compared to older individuals. Well, in the United States, nearly 120 million adults have high blood pressure, but recent research suggests that some of them may have been misdiagnosed, and research presented to the American Heart Association, a doctor with Ohio State's Wexner Medical Center says millions of people with normal blood pressure may be told their levels are too high. He says that is due to the patients not being in the proper place or position during the reading.
That leaves open the possibility that there are either a lot of people being diagnosed with high blood pressure who may not actually have it, or you have somebody who has high blood pressure and is controlled, but you're intensifying therapy, which may not need to be intensified.
American Heart Association guidelines call for patients to be served and seated in a chair with their back supported and feet flat on the floor, wearing the blood pressure cuff at heart level.